So I should start with a kind of introduction, I guess. This is me. My name's Ian McCubbin. So I'm a psychologist. I work at Oxford Children's Hospital in the department there that's generally referred to as children's psychological medicine. So we're kind of a group of 25 or so psychologists who work with children in the children's hospital with diagnosis of kind of various types. But one of the things that I do is for the last almost a decade now, a day a week, I've been funded by the charity Fight Against Blindness, or FAB, to see children at the eye hospital. So children with kind of eye conditions or visual impairments. The charity, Fight Against Blindness, was set up with the boss, Clive Fisher, again, more than a decade ago, I guess, 12, 13 years ago, with the intention of funding psychologists to see children. In the first instance, it was designed for children with inherited sight loss. So Clive has two children with RP, retinitis pigmentosa, and he realized that there was a significant psychological burden associated with this diagnosis. And he kind of keyed into the fact that there was not really any specialist support at all, really, in the whole country. So there's now, I think at last count, 4 or 5 of us. So there's one at Addenbrooke's. I'm at Oxford Children's Hospital. There's one at Southampton, there's one at Bristol, and there's due to be one in Leeds quite soon as well. I think there's been talk about other areas in the UK as well, but beyond that, I think we are the only specialist paediatric provision for children with sight loss, other than the developmental vision service at kind of Great Ormond Street that a psychologist called Naomi Dale leads. So I see children and their families. The families bit is important because I guess it's kind of what's brought us here this evening to a great extent. And what I suppose we'll come back to, the kind of through line through what I'm going to talk about, I think, is that the psychological well-being of the children that are referred to me and the psychological well-being of their family is indivisible. And I mean the family as a whole, as a system, but I also mean the individual members of that family. So mums, dads, brothers, sisters, everybody. And while, of course, understandably, much of the attention goes on the psychological well-being of the child, I'm often, if not quite as interested, I am certainly very interested in the psychological well-being of everyone in that family. So again, I now get referrals for children who've just been diagnosed. I get referrals for children who've reached some sort of transition in life, so going to secondary school, or I guess moving to a new school, or something else happening in their life that's been associated with additional psychological stress, partially as a consequence of their sight loss. I also occasionally see parents who are having a difficult time, in part due to the additional stresses of the diagnosis. And I guess I do bits and pieces of research. So it's, I was going to say it's shameful. It's not necessarily my shame, but it's stunning to me that this area, so psychological well-being of children with sight loss, is as under-researched as it undoubtedly is. We know massive amounts about psychological well-being of children with other health conditions, so children with gastric conditions or cancer or any number of other types of health problems that come to the children's hospital. But actually, children with sight loss, as shocking as it is to me constantly, are actually not a very well studied group. So we're seeking to remedy that too with a couple of sort of fairly sizable bits of research we're doing at the moment. Enough about me. What's brought us here this evening? So this is the plan, and these are some of the questions that I guess Chloe was kind enough to sort of forward to me. I've tried to sort of tackle them in a logical order. I've tried to tackle them in a way which they'll hopefully knit together and allow me to sort of factor in a few additional things too. But obviously, as I said, the intention is not that I will sort of rattle through these and kind of talk endlessly to the exclusion of any kind of conversation or kind of questions. And there are clearly things that need to be covered. And I think Chloe suggested that there are some real themes that are consistent. And some of the themes are here. I mean, one of the big ones, and one of the ones that constantly comes up at the Children's Hospital, not just in terms of sight loss, but also in terms of many kind of significant health conditions that children could be diagnosed with, is the idea of how to talk to them, how to talk to the child about this condition. Chloe at the start alluded to the idea that, of course, parents have a level of understanding about a diagnosis of Usher syndrome way before the child does, in any meaningful sense, or indeed at all. So it's a process of many years, probably. These conversations are ongoing or are built up to. And I guess it would be useful for us this evening to think a bit about how that can be done as kind of smoothly, as gently as humanly possible. So when to talk to your child, how to talk to them, how to talk to them if they have additional needs or other things happening. In some senses, how to empower that child to talk to other people. So not just an adult-child dyad, not just the two people, but also siblings. In some senses, it's not on this slide, but I'm also interested in how children are empowered to talk about their diagnosis at school or with friends or with other people. How to strike a balance between, I guess, preparing for a future that, of course, can be extremely daunting versus being kind of in the present moment, knowing that often the present moment is a less daunting prospect than what could be months or years down the line. I guess it would be important to spend a bit of time thinking about how to prepare children as well as is possible for life, I guess, life with Usher syndrome, but life kind of more broadly. These are subjects related to resilience, related to self-esteem, related to psychological well-being kind of more broadly. So we'll try and cover a bit of that too. How to prepare myself for a parent for what lies ahead. Again, I'm super interested in this. You know, I will repeat this until it becomes either a mantra or kind of incredibly boring. It is indivisible. You know, the psychological well-being of the parent, psychological well-being of the child, for innumerable reasons. But I hope I'll manage to cover at least some of those reasons this evening. So that's the plan. We'll do some PowerPoint. We'll discuss some ideas. We'll leave a big gap to kind of leave those ideas to kind of to think about them, to answer questions, to get in and out of various topics. And then at the end, hopefully we'll come back and I'll try and think of some key kind of take-home messages. So talking to children about the diagnosis. I mean, again, as I said, Chloe kind of alluded to the fact that this is potentially a big one for you guys, and it's something that came up a number of times when she asked people what they wanted to try and be covered this evening. First things first, I guess, you know, this might seem blindingly obvious, but why is it important to talk to children about their diagnosis? You know, why is it a kind of thing that has to be done? Why is it such a big deal for some people and not others? I mean, there is this idea, that lag that Chloe alluded to, you know, parents having complete clarity about a child's diagnosis, a child having an emergent sense of course, difference and the symptoms that they're experiencing. And at some point, these things need to be aligned. There need to be some sense of, I guess, attunement or kind of communication about precisely what's happening for a couple of obvious reasons. But again, I think it's worth making them explicit. And a child is experiencing symptoms and may have the language to define and explain that. You know, a child of say 4 or 5 experiencing the symptoms that one might expect with Usher syndrome may well be able to say to people, their peers, people at school, I have a condition. They may even know the name of it. They may not do. If they don't know the name of it, or they don't understand precisely what it is there a degree of anxiety about what it means? Now, of course, we've already acknowledged the fact that the future can be a frightening place. But the future with an undefined set of symptoms for a child can be that bit more frightening. With clarity around what the situation is, or as much clarity as that child's developmental level would allow them to have, actually is often a less daunting prospect than just a sense of something's happening. I don't know what it is. And you know, kids are smart. Kids know that something is being kind of not clarified here. There isn't opacity. Something is opaque. I'm sorry for the captioner. I'll try and stick to the real words rather than making them up. There's something that's in shadow that is not being properly explained, and that's frightening, right? Knowing that the most important people in your life are not giving you honesty. There is also, I guess, and I appreciate this varies from child to child dependent on type of diagnosis and precisely what's going on, but children are required to adhere to things for their treatment. Now, that can vary. You know, some children are taking vitamins, some children may be on some sort of trial, some children may just have to attend hospital appointments and go through I think sometimes trauma of all the examinations, that appointments that eye hospital or audiology can involve. And again, to have a degree of compliance or adherence with these demands, it's often important for the child to have their own sense of, as much as is needed, what's going on. So they need to understand, I guess. The how to do it bit. Is there a set way? But this, I think, is the thing that is perhaps agonized over the most. You know, how to do this big conversation that's been led up to for, again, many months or years. I mean, first things first, acknowledging the fact that this is important and it's a big deal and everyone worries about it. You know, I think it's important to normalize that this is something that is a very human and very normal and very common worry in this type of area. So there's that. I guess going into any conversation like this, it's important to have the best possible information. And if there's a sense of a child kind of building towards something, a growing need for further information, then I guess it is obvious, but again, let's make it explicit, sensible, to be equipped with all the best possible information and check in with yourself. You know, ask yourself questions, run through a kind of trial run with another member of the family. You know, the child's other parent or whomever is available, to say, okay, if they ask this, do I know the answer? Now, obviously, there's a couple of reasons for doing that. One is you want this conversation to go as well as possible, and you want to be able to answer the questions that your child has. But also, in this conversation, there is as much going on unsaid explicitly as is said. And your child is taking as much from this conversation about the tone of voice and the sense of, you know, safety or fear or anxiety as they are from precisely what's being said. If you are well equipped and you feel confident with information, you're probably going to be in a position where you can have this conversation more confidently, I guess, for want of a better word. So you can discuss the stuff through, you can field the questions, and you can project a sense of, if not exactly certainty, again, you know, confidence, and that's going to reduce the emotional temperature of this dialogue. It's worth saying too, often people are envisaging when this conversation arises, you know, when the child is 5 or 10 or however old it takes to build up to the conversation where everything is laid bare, that it will unfold, you know, at a table with the family there, and it'll be a full and frank conversation. Everything will be unfolded, and all the details will be kind of discussed, and all the facts will be kind of agonized over, and it will be a massive moment for everyone. It's often not the case. I mean, in fact, I think it's quite rarely the case. Many of you may have experienced this. For some of you, it was the big conversation, but actually, for I would say the majority of people, and I'm happy to be corrected here, I think for the majority of people, it's not the big revelatory moment. And to be honest, it's probably, generally speaking, better that it's not. I'm not saying that there's any harm to be done necessarily in the big conversation and the kind of 2-hour chat with the child and all the facts laid bare and the Googling together and making sense of things. But what most children need is the slow drip, drip, drip of information. Now, I should say, and I should have said this at the start actually, I should have front loaded this. Usher Kids UK have a brilliant page on this, how to talk to your child about the diagnosis. It's really good. Had a look at it today and thought, everything I'm about to say has been preempted by the website. It's going to look like I'm just reading off it. But as the website says, you know, drip, drip, drip of information. I'll come back to this, but there's actually a number of excellent resources. The Usher Kids UK website page and how to talk to your child, great. Sense have a great resource that's linked to from the Usher Kids UK website, which I hadn't seen before actually, Chloe, so thank you for that, because that's, again, excellent. It covers loads of stuff around how parents might feel about this conversation, what they may bring to the conversation too. And lastly, the RNIB have a leaflet called Tough Talks that I kind of habitually have used in the past, which is also excellent. It gives you some really good ideas about, again, how to have this conversation. And if you collapse them all together and look at them all, one of the main themes is the idea of the drip, drip, drip. You know, the child comes to you, asks a question. You may feel a sort of certain level of anxiety yourself. This is the big moment. The conversation is happening. You answer a question, and that was enough. The child goes away sometimes. maybe not always. But again, what's proportionate? What's required? If you give the child what's proportionate, what's required for their developmental level, what answers their question in a way that makes sense for them, it's often enough. 2 weeks later, they may come back. Now, I'm not for a moment advocating dodging the question. Let's make that very clear, that there's huge therapeutic value to be had in this sort of conversation. As well as giving out information, you're coming together with your child to do something deeply important. And again, that's valuable for your relationship, for the attachment between you and the child. And also it's hugely important for them to feel more confident in managing their own diagnosis and managing it psychologically, as well as in terms of their adherence and everything else. And it doesn't need to be done all in one go. So I suppose it's about a willingness and an availability to have those little conversations as they arise. I guess this is true of developmental level, as well as age, as well as other needs. I mean, it's your children, and you know them better than any professional is ever likely to, right? So you will know the type of information that they find it easiest to access if it's a conversation with the two of you. If actually they might benefit from a little leaflet that you can kind of find online somewhere if you go through it beforehand. If they prefer something from YouTube or some media thing that they can access, that actually they'd rather go away and just kind of digest it themselves. Of course, if they have a diagnosis that puts them somewhere on the autistic spectrum, then there are things that one should avoid. Again, you know your children, so I'm not going to patronize you, but it's avoiding abstraction, avoiding metaphors, try and make things as explicit and concrete as possible, checking understanding. But again, most if not all of your parents, I appreciate there's a couple of you that may be professionals, but you know how your children learn about other things. This is not so different, or it doesn't need to be so different, despite the gravity that it may feel that it has. Who should do it? I mean, again, this is kind of a through line in a number of the resources as well. I mean, as a rule, yeah, I mean, you should do it, I guess. You know the child, you're attuned to them and their needs. They might not want to have the conversation with you, though. That's a kind of complication to this. Again, children have their own emotional needs, and if for whatever reason there seems to be a bit of a barrier here or an obstacle, the 2 or 3 of you, or however many are in this kind of family group, are approaching this subject, but it seems the child does not really want to go there with you. They may have made a decision, actually, they don't want to have a difficult conversation with you. They'd rather keep you for a more kind of safe base. They want to go away and have a difficult conversation with a teacher or a TA or a member of the pastoral care team at the school or a QTVI, a qualified teacher for the visually impaired, or somebody else, a grandparent or an older sibling or somebody else. I guess that kind of conversation is that little bit harder to manage, of course, to contain, but it can be about equipping a person, whoever they are, with the information to then have the conversation with the child. Now, it's not so different from how you would have done it and how I would advise you to do it. Seeking advice from optometrist, ophthalmologist, audiologist, genetics counsellor, whomever that's most involved in the child's care and who you get on with best, to be signposted to the best information. And then rather than you taking that to the child, I guess what we're asking you to do is then to give that to whoever this professional is and ask them if they are able to do it because the child has chosen them. Again, that may be something that the child wants to do just to have their relationship with you for something else. And again, if I was to default to one relationship to facilitate this conversation, it would always be a parental one. But the rights of the child in here are super important too, and better that they have the right information and the conversation happens in a way that they feel is contained emotionally and manageable, then they try and wrestle through something that for whatever reason they just don't feel that you and they together are equipped to do. I put in white lies because I think white lies are a bit of an interesting one. I don't know if the idea of white lies is a terribly British term, so I should explain if it is. I guess I'm talking about the idea of kind of seemingly small incidental lies not truths that you might tell a child just to protect them, right? This is a big subject with gravitas and significance. And often when people approach that sort of conversation with the child about anything, right? If a grandparent dies or something happens that is adult and a bit weightier and perhaps more frightening than the average conversation you have with your 7 or 8-year-old, you will spin them a sort of version of facts that are maybe not quite as explicit or as comprehensive or as sophisticated as you would do if they were older. Now, the idea of spinning things, this is obviously a political term. You take a fact and you try and shape that fact in the way that is most easy to digest for your audience, in this case, your child. There is no harm in that. I think it's if you have a very switched on child and they ask a question and you try and fudge your response, they will know that and you will know that they know that. It's palpable in the conversation, right? You think, oh no, I've tried to explain this. I've tried to dodge the question, and clearly they're not satisfied. Clearly they know that I've withheld something. There are no landmines here. There are no kind of massive traps that if you fall into it, the relationship is completely ruined. So I wouldn't be concerned if that's happened to you in the past. But if a body of those sort of conversations build up, then there's a problem. And the problem, I guess, is how is that child going to subsequently trust what you say if they're aware that repeatedly when they've asked you about something that is desperately important to them, you've not told them the truth? So it sounds like I'm fence sitting here, and I kind of am, and I kind of am intentionally and knowingly. I think it's okay to try to fudge things slightly, or try to keep some of the more concerning elements of the future that you perhaps are most frightened about from your child. But at the same time, be very cautious about just telling what's obviously a lie to them, knowing that in the longer term, this is going to have quite significant implications, perhaps, for how much they trust you or a health professional in the future. So I'm kind of cautious about that I think. How do you talk about it as a family? This I think is really interesting as well, because everyone brings different stuff to that sort of conversation, I guess. Now, family can mean different things to different people, right? And this is a question that I have encountered fairly often, actually, in clinical practice. People say, for example, my family just don't get it. I want to be able to talk to them about this. They don't understand, and it's causing conflict. So clearly there's a need, right, to have this sort of conversation, and there's a need to have some greater understanding in the family system. Now, again, precisely what a family means in this context will shape precisely what you then go and do. If, as in the example that I'm thinking of, there is a misconception in the family, so there's a parent, perhaps, who's maybe just not quite understanding the specific needs of the child, or there's a sibling who again is not quite getting what's going on and is making unreasonable demands of the child or of the situation. Obviously, having access to the right information can help to shift that. Now, if it's a parent who needs more information, not so difficult, or a grandparent, again, not so difficult. If it's an adult child or a kind of teenager, again, not so difficult. There's lots of resources available online that you can point someone to. Some of it are things like you'd find through the RNIB or Sense or Usher Kids websites. There's some pretty innovative stuff out there that you can use as well to try and explain visual impairment and hearing loss to people who are naive to these subjects. So there's lots and lots of simulations people can access on YouTube. There's a website called seenow.org, which again tries to simulate kind of what it would be like to have specific visual impairments, I think including kind of RP type stuff, although certainly kind of macular degeneration type stuff. There's those kind of old props you can get, the glasses that you take around schools that sort of simulate things too. These tools, I think, can be useful. Not so much the old kind of goggles they took around schools with bits of the vision occluded. They're slightly kind of low tech, I think, these days. But the websites are good. There are apps as well that are not bad that you can, I think cnow.org is one that actually you load through your phone, and then you can move it around the room. And by looking through your phone, it does a reasonable job of simulating what various types of visual impairment may be like. So there are tools. Again, I come back to this idea of, can we empower the child to do this themselves? By sitting down with the child as a parent or even as a professional and finding out what they know, and then trying to get that information in some format they can give to other people. So on a Word document that they can do text to speech software with, or that they can use some sort of accessibility software to collate and put together. I mean, in whatever format they can, where they can get this information down in a format they think is accurate and is acceptable to them, then give it to people and give it to the family member who's not quite getting it to try and explain. I mean, back when life made sense, you could bring people to appointments at the children's hospital and they'd come along. Bring a grandparent, bring your brother, bring someone else, and have the ophthalmologist try and explain to them what it's like using all the tech that's at the disposal of the professionals at the eye hospital. These days, I think you have to try and get a little bit more creative, because I guess needs must, right? You can't bring people along to appointments, or at least we can't. We don't have that capacity at the moment in Oxford. So you have to try and use technology just to try and explain stuff. It is worth sort of saying too, I think, this is a therapeutic process. Getting that child to talk about their condition in whatever format talking takes. So some children I've worked with have chosen to do a big presentation in front of their classmates at school. It could be several hundred people in the audience. Some people have chosen to talk to a sibling. Some people have chosen to talk to a group of their friends, one or two of their friends. If you think about this in terms of adjustment, so adjustment to a diagnosis, which I think is what we're sort of talking about in terms of how to talk to a child, how to give them the information so they're not overwhelmed or traumatized or distressed. Adjustment is about a few different things, but if something is aversive or frightening or stressful, the human response to that is to shrink from it, to avoid it. And the more you avoid the thing, whatever the thing is, generally speaking, either the worse your anxiety gets or the more ingrained the avoidance gets. By gently approaching the thing, in this sense, the thing is the Usher syndrome diagnosis, or whatever diagnosis the child has, you start to address that avoidance. And by getting a bit closer to it, in whatever way feels acceptable, and exploring it a bit, in whatever way feels sort of gentle, you sort of unpack it. And the child's aversion to that subject will go down a bit. And the more they can move towards it, the less aversive they may find it, and the more they may feel able to engage with it more. And actually, the stress that they experience around it may drop. And they may feel more able to engage with tasks like, for example, meeting a QTVI, so again, the qualified teacher for the visually impaired, or a member of the low vision team from the kind of local authority and doing cane training or whatever else. So adjustment and avoidance are two sides of the same coin. And by moving a child towards it, I guess what we're doing is we're addressing some of that avoidance and aiding their adjustment. So writing it down, writing a song about it, I don't know, doing it whatever they want. I know some children record like YouTube videos to talk about their condition. That's not so unusual these days, I think. I've worked with a few who've done it. I'm exceptionally low tech. I can just do it deal with YouTube. If they get onto anything like Discord, things like that I've heard of, I'm lost. I don't know what it is. But, provided they have the guidance of their parents and, they know what they're doing, finding some way to explore the subject in a supportive environment gently is kind of a massive thing. So I think that's kind of a big part of it, and a big part of empowering children to make them feel a bit better about it. I think, what else do I want to say about families? I guess, again, there's a role for parents in supporting this, clearly, as I've said all the way through. So if it's about writing down kind of a little list of, my name is David and I have Usher syndrome, or whatever they want to call it, it affects me. This is how it, affects me. This is why I've got it. This is what it does. This little explanation. The two of you can do it together. And again, this is going to enhance attachment around a very difficult and challenging subject. So talking about it as a family can be daunting, it can be difficult, it can be a real core part of the sort of work I do, but ultimately it can be hugely therapeutic and very important. Okay, so how to help your child, I guess, with kind of future challenges. Coping with anxiety, confidence, self-esteem, resilience. When are children likely to encounter challenges? How can parents help them to develop confidence, develop self-esteem? How can we get them to be resilient in the face of significant challenges? So I guess there's a lot of stuff in this. I've kind of, I think, unpacked this a bit into the idea of confidence and self-esteem and resilience, because I think these are all distinct but very heavily related ideas. I think these are the sort of things that, again, if you work at a bit and you do with, a bit of thought and a bit of support, perhaps, can pay dividends in the longer run. I mean, it's not a thing that you do and then it's finished. It's a process that I guess you engage with more or less at various points through a child's kind of development. And the more you can engage in it and engage in it in as rich and as full and as comprehensive a way as is possible, I guess the more likely they are to be resilient and confident in the longer term. But I guess the reason why we're talking about this is there is an acknowledgement, I guess, that we've brought this up, that of course, having any significant additional health or sensory issue is an additional burden or factor or thing that a child has to deal with on top of everything else. Of course, that mounting burden of stuff that children have to deal with these days anyway, next thing on top means, I guess, more thought needs to go into this sort of stuff. So I guess kind of definition stuff. I mean, this is all to do with identity, right? Identity is to do with essentially what makes up you and how you see you. Self-esteem is just, I guess, how children see themselves. So positive self-esteem means, I guess, on balance, the child has managed to retain a positive view of themselves kind of in the round. Factoring in all the stuff that's happening, they still feel pretty good about themselves. Resilience, well, resilience is, and this may be obvious, but it's the capacity of a child or anyone to encounter challenges and to retain a relatively well-functioning emotional well-being or relatively well-functioning mental health. So resilience is kind of enormously important in all this, but self-esteem and kind of confidence are as well. Confidence, I guess, in this context is how able is a child to believe in their own judgment and their own ability, and I guess that's very closely tied to the experiences that they've had in the past and the ability that they've had to do things and do them kind of successfully. I guess, as I've said, it's key for children anyway, but children with additional needs, it becomes that little bit more important, I think. When are they going to encounter challenges, I guess? It's worth kind of pausing on that for a second, but again, I've kind of touched on this, and it will be obvious to some of you. Challenges, particularly challenges, I think, with children who have sensory loss, will arise at points where that sensory loss makes the biggest possible difference. So in some senses, you have, I guess, a couple of processes. There's an emergent sense of self taking place through childhood. And as that sense of self emerges, a comparative sense of self relative to their peers, any difference that marks them out as being different to themselves and their peers starts to become more important. And those of you who've seen a child kind of mature from birth all the way through to adolescence and adulthood will have an awareness that this is a kind of fairly long process. I mean, at age 4, children will already have a sense of how they are relative to their peers and what some of their peers at school, their friends, do and don't do, what issues they may or may not have, and the child has already got a sense of themselves relative to them, and that's starting to shape some aspects of how confident they feel in themselves or not. But as well as that trajectory, there is also just significant transition points. Like I said, going to school, big deal. suddenly being asked to do more things, suddenly having perhaps more pressure put on oneself to learn, things being put up on whiteboards in the class, suddenly a sense of this person does not know my needs as well as my mum and dad did. They're not meeting my needs as well. Something is up. Other kids are managing to access this stuff and I can't. Now, in an ideal world, schools wouldn't do that. In an ideal world, schools would be plugged in to the needs of the children that are in each class. You will all know, and I suspect many of you will know far better than I ever will, that this is not the case. In fact, it's often not the case. But it's probably not unreasonable to say it's rarely the case that they get this right, schools, from minute one, because how could they? This is not meant as a criticism of schools, by the way. With a class of 30 children, many of whom have fairly kind of complex and diverse needs, they're not going to get it right from minute one. So transition points are going to be sort of significant. Noting differences with your friends learning to drive, people going to university, transition points. So it's not unusual for a child to be referred to me when they're, let's say, going to secondary school, and actually I see them for a handful of sessions then, let's say 8 meetings. It's fine. They improve a bit. I don't see them again for years. They're referred back to me when something happens at school, or their friends learn to drive, or some other, big developmental milestone. So again, it's a kind of trajectory and milestones, transition points. These are the big issues that sometimes throw up more problems. Confidence. I mean, I guess, how do you build confidence in a child? How do you build confidence in anyone? I guess, how do we build confidence? It's I guess, a couple of things. 2 sources, I would say, 2 main sources. It's the relationships we have, and it's the things that we do that make us feel competent, right? If we're doing lots of things that we feel kind of good at, that we feel have skills at, musical instruments, sports, academic stuff, creative endeavors, other things that I'm not thinking of right now. If we're doing those sort of things, we feel good about them and that we are effective, we're doing well, then of course our confidence tracks up. It's not terrifically difficult to do that. Well, it's not terrifically difficult. It is sometimes really bloody difficult to do that with a child, actually, depending on how agreeable the child is to doing the thing. If you can steer them in the direction and nurture the things that they do and do well and facilitate those as much as is humanly possible, of course, this will help to build confidence in that child. Now, it's difficult, particularly as a child nears adolescence, and in some senses way before that, depending on the child. They may be entirely disagreeable with doing the things that they're good at. They may give up in sports, they may give up on musical instruments, they may give up on lots of sort of things. But where possible, if you can try and keep them involved in the hobbies and sports that they love, and the bits of craft, the bits of creativity. I worked with one kid with huge limited vision. He had an RP diagnosis, as it happens. He still does. For the longest time, even with extremely limited vision, he was doing comic books. Good comic books too, wicked comic books. Mum managed to get one of them sort of, I was going to say published, bound, certainly. I think she had a few of them printed as well. And he glowed when he talked about it, gave him a massive boost. When the things that a child does well are noticed and celebrated, again, it sticks. This stuff is innate within. You identify, you celebrate, you engage with them doing a thing, gives them a bit of a boost. The other thing, as well as the kind of competence thing, is a relational thing. The relational thing in this context is children will sort of take their cues about their own competence and the safety of the world, I guess, from you. There's social learning happening all the time. Whenever I find myself playing my phone in front of my children, I'm horrified. And I remember the fact that they're just going to see me doing that, and they're just going to, grow up playing with phones. I have to sit and pretend to be reading a book with a mobile phone stuck behind it. At least then I feel that they're going to think that I'm more intellectual than I am. But they will take their cue from you. Now, if you can project a sense of safety for them, the world is an okay place, to some extent, kind of regardless if you believe it. And again, kind of support them to do things that they might find challenging, be competent, be empowered to do things that give them a sense of mastery and competence and skill. That's going to help. So facing adversity of some sort is it's tremendously kind of powerful for children. Facing adversity, overcoming it, it's going to do massive amounts of good for the self-confidence. There's a charity in America. It's not a charity, sorry. There are camps that people can go to in America. Somebody is here from America, so they may know about this, maybe they've been, where children with, I think it's just a visual impairment. I don't think it's a kind of dual sensory loss, although I could be wrong. And for a number of months, I think they live on site and they're taught all the skills that would be associated with kind of being more successful in the world with sensory loss. And at the end of it, there's a process called, I think, the drop, which sounds kind of sinister, where the young person, who I think would be 18-ish, is taken to the middle of an American city and just left there with a kind of old school phone that doesn't do Google Maps and a kind of $20. And they're asked to find their way back across the city that they don't know to where the kind of camp is sited. It sounds terrifying. It also sounds deeply unethical. But imagine how brilliant that young person, sorry, the 18-year-old or 19-year-old, going to feel having done that. I'm not suggesting you drop your children off in the middle of, Birmingham or Reading or somewhere and ask them to find their way home. But I would notice with you, in terms of confidence and self-esteem and resilience, that adversity is super important. Having the capacity to overcome stuff that is a challenge. And I'm sure you can all think of your own children and think actually about how in the past they've overcome something they didn't want to do, something they thought they couldn't do. And you supported them to do it, and you coerced them and you bribed them to go and do the hard thing, whatever the hard thing was. They did it. Afterwards, they beamed. This is what we're looking for. This is what kind of can really make a difference in terms of confidence and in terms of resilience too. Self-esteem is a very related thing to confidence. If you're building confidence, kind of by definition, you're sort of building self-esteem too. Self-esteem is about what makes us up as individuals, right? It's about a sense of identity. And again, it's about nurturing all the different bits. Now, if anyone has a condition that necessitates lots of hospital appointments and conversations and in some senses, medications or treatments, that can become a very dominant part of that child's identity. For kind of positive self-esteem, I guess you need to try and refocus on the other things that they do well. And again, this kind of leads back to the idea of competencies and hobbies and whatever else it is, but it's kind of bigger than that. It's about what aspects of their personality do you really value? What skills do they have? There are tasks you can do, and perhaps maybe I'll give Chloe some information to distribute after this kind of workshop. But there are tasks you can do whereby you ask members of the family to write down, the 3 things that they admire or value most about the child, and you can collect them all up. And if it's a teenager, they'll die cringing with horror going through these things with them. Nonetheless, it starts to light a little fire, a little confidence in, oh, people think that I am compassionate. People think that I'm patient or kind or funny. All we're doing is we're broadening out the definitions that are being associated with this child. And at the moment, with kind of remote learning that's happening, with the pandemic, with all the demands that are being placed on the child, if you have additional sensory loss or other diagnoses too, then there's not a huge amount of space for that sometimes. We're noticing the positive attributes that a child has and, kind of paying tribute to them, celebrating them. So again, you can do creative stuff with that. Once you have the adjectives that the family use to describe the child, the traits they value, the aspects of their personality they love most, you and the child can try and create something out of those. Sit down a computer program and try and make a bit of music to celebrate it. If they have sufficient vision, you can sit down and make a little collage, cut some stuff out, stick it on a bit of paper, observe a ceremony or a process of sort of celebration. The more you can engage senses, the more you can make it into a process, the more likely this is to stick, to be a real meaningful object to them. It's going to boost them up a bit. It's going to make them feel kind of more confident about what they do. I come back to this idea again. Independence is a huge deal, right? And again, I'm sure you all know this, so I'm kind of preaching to the choir slightly, but the more you can empower a child to do things that will boost that sense of independence, however you do it, Independence is a massive predictor of self-confidence in children with a VI, and self-esteem, sorry, with children with a visual impairment. Anything you can do to sort of boost up that independence. Again, support them to go out and kind of explore the neighborhood, facilitate them learning bus routes. They can go into town and see their friends, sorry. Whatever you can do to promote that sense of independence. Cooking meals, it's the more independent they're going to feel, the greater sense of self is, the greater sense of self-esteem. The message about themselves is not going to be I'm vulnerable. It's going to be, I'm able, I can do these things. Resilient, I kind of covered resilience a bit. I do think that there's a lot to be said about experiencing adversity and overcoming it, doing the tough stuff, right? I also think there are things you can do to boost up a child's sense of importance in the world. There's a technique I always really like called love bombing. Many of you may have encountered that definition in various places, but there's a psychologist who's local to me here. I don't know him, sadly, called Oliver James. Oliver James wrote a book called Love Bombing about, again, the better part of a decade ago, I think. If you Google Oliver James love bombing, a Guardian article comes up that describes it. It's a very simple process, but it's deceptively so. It's just about giving a child control over a day's activities or a weekend's activities. There's lots of really, real positive outcomes associated with that sort of task of saying to the child, right, whatever you want to do this weekend, we do it, without exception. And if you want to sit in your pajamas all day and eat candy, we'll sit in pajamas all day and eat candy. If you want to go and ride roller coasters, we'll go and ride roller coasters. It's promoting a sense of autonomy, independence, agency, confidence, predictability, power. You have authority here. We're going to go and do the things you want to do. And if you want to sit and eat candy all day, we'll do it. Most children don't, by the way. Most children, when push comes to shove, will not ask to go and play Grand Theft Auto on the PlayStation all day. They'll want to go and do stuff. Go to the zoo, go and see someone, go to the cinema. I know at the moment this is kind of contentious because many of us are in kind of pandemic-based lockdowns, but within reason, what can we go and do? So that idea of kind of quality time together, super, super, super important. And again, building relationships really help to mitigate the impact of stresses and life events. So super important. It's worth saying too, and I'll say this before we move on to parents briefly. There are kids who go through a lot of stuff like sensory loss or diagnoses that require kind of input from professionals that do ultimately need that input from professionals. That wasn't a very good sentence, but I suppose what I'm noticing is some kids need help, and it's important to put these sort of strategies in place to try and build that child's confidence, to promote self-esteem, to build resilience. And it's important to acknowledge as well that there are lots of kids who ultimately will need help from, in Britain, Child and Adolescent Mental Health Services, or CAMS as we call it, CAMHS, or from kind of pediatric psychologists, so psychologists like me who work at children's hospitals. And actually knowing that there is help out there, and it may not be specialist help. I don't know about the provision in the Netherlands. I don't know about the provision in the States or Australia. I know a bit about Australia, actually, not that much. But while it's obviously ideal that the psychologist or mental health professional knows about sensory loss or related subjects, it's actually not critically important. Often, children that are referred to me will do as well or better with a school counsellor who they can go and see and not experience all the stresses of getting to hospital and getting parked and waiting around. So accessing help is super, super important. I'll just go through this slide, then we'll kind of stop, I think, because I don't want to just completely exhaust the warm welcome I've been given. So how to prepare yourself for a parent for what lies ahead. Now, I'm really interested in this. Like, I'm super interested in this. I'm interested in all this stuff, but I'm passionate, even maybe more so than the rest of what I've discussed about parental mental health. Often, and it is worth saying this, often in my experience, I think this is probably borne out by the data and the research, although I'm not so sure. In my experience, often the parents can be experiencing more distress as a consequence of the child's diagnosis than the child is. Children are famous for being resilient. They just bounce back. We can do things to boost that resilience, there is no doubt. But often, they have a diagnosis, particularly if it's one that they are, of course, born with, or at least they're born with the condition, forgive me, and they kind of adjust to it. And yeah, they have moments where it's difficult for them, but often I have children refer to me where there's a presumption that the impact of this diagnosis on them will have been catastrophic, seismic, and the parents are in pieces. The parents are crying and upset, and the child is, okay in relative terms. Again, people are resilient. Children, particularly, can be resilient. There's a core idea here as well, and it's worth front loading this. The diagnosis, having a child diagnosed with any significant health condition can be hugely traumatic for parents, but not always. And I know this sounds extremely obvious, but the point I suppose I'm making is people cope differently. That's not predicted by how much they care or how much they're engaging with the subject, although these things are important. There are predictable, what I would call trajectories, as in like I can't speak, the trajectory that a bullet would take. Excuse me. There are trajectories of adjustment following a potentially traumatic event. There's a researcher called George Bonanno, who's a psychologist in the States, who did a lot of research into this and looked at how after significant and potentially traumatic events, some people have a massive interference in their general level of functioning. I guess that's what we usually describe in common parlance as they're not coping well. They can't go to work, they're really struggling, they're in floods of tears. There are some people who seem stunningly to be fine. And he studied people who survived 9/11, other terrorist attacks, had health diagnoses, experienced all sorts of trauma. Some people, pretty substantial group, can't remember exactly how many, but let's say of the order of 15 to 20%, say, are just okay. They're what he would categorize as resilient. Some people initially really struggle and then recover, and some people are initially fine and in the longer term struggle a bit more. But what always strikes me by that is actually kind of all bets are off at time point one. Someone might look like they're really struggling, but will be fine with a bit of time and with almost no other intervention. At time point one, some people might look absolutely fine, but across time they may find it increasingly hard to cope with stuff. But people have to sort of find their own way. So kind of what I would say is all bets are off. People will cope however they cope. It is important to kind of think about the system, the family. Again, people very understandably want to prioritize the needs of the child, particularly as a parent. Speaking as a parent, you look to the child and think, I would do anything for this child. Don't worry about me. My well-being is not important. I will work myself into the ground. I will do whatever. I just need my child to be okay, or as okay as they can be. While it's an entirely human way to think, it's not necessarily the most therapeutically adaptive way to think. If the child exists in a system, and children exist in systems far more than we do, no man is an island, but as an adult, you can kind of go away and disengage from your family and live your own life. A child can't. And the child's psychological well-being is in part predicated on the psychological well-being of everybody else in the family. And as a consequence, as parents, it is really important to prioritize your psychological well-being, knowing that in doing so, you're also prioritizing the psychological well-being of the child and any other child in the family too. It is indivisible. Everyone's needs have to be recognized. Everyone's needs have to be acknowledged, explored, and in some senses, prioritized. It may sound odd to say that we're prioritizing everyone's needs, but that's kind of how it feels. We have to look after everybody. There is, of course, this idea that I touched on earlier. Children will take their emotional cue from you in a conversation. If, for example, you have to take them to the hospital for some investigation with an optometrist, say, if that idea evokes the idea of the diagnosis, the idea of the diagnosis is unbearably upsetting for you, it would not be unreasonable for you to become upset, and the child will absolutely pick up on that. Now, I'm not saying this to stigmatize anyone's emotional reaction. That's not necessarily a bad thing, but it is important to understand that that child will then feel more fearful of it, having seen the most important person in their life looking concerned. So if you want to try and promote a sense of calm and keep everything as kind of peaceful as is humanly possible, I think it becomes imperative then to look after your own psychological well-being and to prioritize it, to facilitate those sort of appointments, meetings, and conversations. It is worth saying, though, becoming upset while in the company of your child can feel a bit weird. You know, if you get terribly angry or you become overwhelmed with sadness, there is a tendency for us to feel, of course, either bad about it or just want to ignore it or not go near it. It is not an opportunity potentially lost then to equip your child with skills around managing their own emotions. If they see dad is in floods of tears about something, and then dad names what's going on, I am really upset. Yeah, I've been thinking a lot about what's going on, and I am a bit worried about, going to the hospital, and, I'm a bit concerned. Well, there's an opportunity there to identify emotions and to manage them, and that's kind of super important. So, in the grand scheme of things, actually, these sort of occasions can be incredibly valuable, even although, as parents, most of us don't want to be having that sort of conversation with their child kind of ever. It's worth saying too, identifying and prioritizing your own needs. So, not without exception, but fairly often, I'll see couples that have what I would describe as being not compatible coping styles. Now, what I mean by that usually is one parent has said, I need to know more about this. In fact, I need to know everything. I want to know about research trials. I want to know what the data says. I want to know about the science. I want to know about the prognosis. I want to know everything. Another parent goes, I can't do it. I want to, dig myself into a deep dark hole and think about nothing to do with this. Or, slightly more adaptively, I want to be in the present moment. I want to be in this moment now, which is kind of relatively happy and relatively safe. Not think about 6 months or 12 years or whatever in the future. I just want to sort of be here. Now, generally speaking, avoidance is not a terrifically good idea in the longer term, but people are entitled to cope with stuff how they want to cope with it. And if someone says, look, I want to go for fun stuff with my kid, I want to hang out where Usher syndrome is not a topic being discussed or any other health stuff. We want to kind of have fun together. I don't want to think about this topic at all unless I have to go to hospital. I kind of think fair enough. The problem, of course, is if two people that are in a couple have these divergent or not compatible coping styles, they need to have their needs met. Now, it is, I think, critically important for couples to be able to sit down and have some sort of conversation together as a means to facilitate your relationship. You can't just go off and have your needs met elsewhere, because for the system, that's not going to be a kind of optimal move. And if all you do is sit down, check in with each other, say how you are, what you're struggling with, what elements of the current situation are difficult, and then acknowledge the fact that actually I want to go and do all the research. I'm going to contact the consultant at the hospital. I'm going to find out about all this stuff. But if you don't want to know it, then I'm not going to tell you. Another partner can say, actually, you know what? I appreciate that. I don't need to know. You're coming together as a couple. You're supporting one another. And you're acknowledging the fact you may need to find other places to meet your emotional needs, which are important and are kind of vital to meet too. However you want to meet your own emotional needs, do, right? But what I would say is people do different things. Getting fresh air, exercising, trying to get some sleep, the kind of fundamental Maslow's hierarchy of need stuff, right? Looking after yourself, eating well. Many people will do things like meditating, again, no bad thing, trying to develop skills to manage their emotional state. Some people may do things that are slightly less healthy. They may smoke cigarettes, they may drink occasionally, kind of slightly more than they should. I'm not necessarily against any of these things. Drinking too much alcohol in the longer term is not great. of course, but I think space has to be made for acknowledging each of our needs, what we need to do, ring fencing that time as best we can, and then going and doing the thing. If the thing is lying on your floor for an hour and meditating, you need to go and do the thing because you need to be part of this family and function as part of it. If the thing is, I need to go to the local woods and run there for 45 minutes to reach some sense of kind of calm, you need to go and do the thing. Everyone needs to try and find time to go and do whatever the thing is and be supported to do it. And if doing that thing, whatever the thing is not enough, then again, as with your children or as with the children, seek support. I mean, you may find support through for example, the RNIB forums on Facebook. Maybe there's people there who have had similar experiences you can talk to, and that kind of meets your needs. Maybe you need to talk to a professional, a counsellor, a psychologist. You know, your GP in Britain, so your general practice doctor, or whatever doctor you would see, your family doctor, I guess, in the States or in Australia. I'm sure we'll be able to signpost you to some sort of help. And again, I've seen mums, I've seen dads one-to-one for a number of sessions. I've heard mums and dads to other psychologists because, again, it's important. And it is important not just for an individual, and that is important in of itself, but it's kind of important to the system too.